Sleep paralysis is one of the least understood sleep-related problems, and it definitely does not get enough attention in medical care. It is also quite common. According to Harvard Health, every 2 out of 5 Americans are suffering from it. Research shows that sleep paralysis usually starts during teenage years, while most reported cases of sleep paralysis range from 20 to 40 years of age. Unlike sleep apnea, sleep paralysis doesn't have a proper cause. What sleep experts and researchers do know about sleep paralysis is that it disturbs the REM stage of sleep, where your most vivid dreams take place. It can be classified as hypnagogic and predormital, which means that it happens while you're falling asleep. Sleep experts believe that sleep paralysis happens when the brain becomes alert in between REM and other sleep stages. During REM sleep, your body enters a stage called antonia. This basically means that your muscles become paralyzed, which is a normal part of sleep. On the other hand, sleep paralysis means you're awake and aware of what's going on during the antonia stage, but there is nothing you can do about it. But what makes people susceptible to sleep paralysis? Unfortunately, no one has been quite able to find that out just yet, but some risk factors can contribute to it. Those factors include PTSD, sleep deprivation, sleep medications, chronic anxiety, depression, and sleeping disorders such as narcolepsy and apnea. So, how do you tell if you have sleep paralysis? Well, many symptoms can show if you're experiencing sleep paralysis, and we're going to break them down one by one. Number 1, unsurprisingly, paralysis. One of the most distinguishing and quite possibly excruciating symptoms of sleep paralysis is the inability to move, otherwise known as paralysis. You are fully aware of your surroundings, but your muscles just stop reacting to your will to move them. Number 2, hallucinations. Sleep paralysis coincides with REM sleep, which is the sleep cycle predominantly responsible for restoring memory. But it is also responsible for your most intense dreams. People who suffer from sleep paralysis sometimes experience hallucinations, and those hallucinations can include demons, intruders, evil noises, apparitions, or a sensation of a sinister presence. Number 3, physical symptoms. Sleep paralysis is sometimes accompanied by achiness and pain, muscle discomfort, headaches, difficulty breathing, and chest pressure. The last two are two of the most common symptoms which have resulted in countless images of demons sitting on people's chests. These symptoms can also extend beyond the episode. Number 4, psychological symptoms. Episodes of sleep paralysis are sometimes so intense that mental health can be impacted. The reason why is that people experience intense feelings of fear, paranoia, doom, and dying. The good thing is that those feelings wear off after a while, but they can impact mental health if one particular feeling is experienced often enough. So, can you get rid of sleep paralysis? Fortunately, it's not all bad news. Sleep paralysis can cause a lot of stress, but it does not result in serious health issues or death like many speculate. What is concerning about sleep paralysis is the effect it has on mental health. Right now, there is no single cure for sleep paralysis, but there are some tips that can help you keep everything under control. You can learn how to cope. Some people have learned to do exactly that through a combination of physical and cognitive relaxation, and you can do the same. For example, you can write down a list of affirmations and factual statements, like "My sleep paralysis episode won't last" and "Sleep paralysis won't do any harm to my body." This list can be as long or as short as you wish. The most important thing is to memorize it and practice it. You can also seek out help from a mental health professional, which is our next tip. Don't be afraid to go to therapy. There is nothing wrong with doing so. Not only can you talk about sleep paralysis, but you can also address other mental health issues, which may include depression, chronic anxiety, or PTSD, all of which increase the risk of the former. Next up, learn to deal with stress. Yes, therapy can help you deal with potential mental health issues, but you will want to learn how to deal with stress as well. Some of the ways of dealing with stress include physical exercise, exposure to natural sunlight, and relaxing exercises such as yoga and reflexology. And don't forget to treat your other sleep disorders as well. Unfortunately, it is possible to have more than one of them at the same time. Other sleep disorders can also affect your mental and physical health and contribute to your sleep paralysis. If you're suffering from sleep apnea or narcolepsy, reach out to a health professional so you can treat them properly. Last but not least, make sure you invest in your physical health. While there is no cure for sleep paralysis per se, you can accomplish a lot by investing more in your physical health. For example, regular exercises and a healthy diet can lower the risk of high blood pressure, which is linked to sleep paralysis. And that is just the tip of the iceberg, as regular exercise and a healthy diet have numerous benefits for your mental and physical well-being. What about you? Do you struggle with sleep paralysis? Let us know in the comment section below, and don't forget to subscribe because we have more awesome content coming your way.